My name is Dr. Rinesh Chetty. I'm an orthopedic and spinal surgeon practicing in private practice in South Africa. I've got a little bit of years of experience prior to orthopedic surgery as a forensic medical officer in the United Kingdom. I've completed my diploma in medico-legal law during the lockdown while I was treating COVID as well, and had some free time, so I decided to do my diploma. And I've got a special interest specifically in the criminalization of medical legal negligence, as well as medical legal law. When it comes to private versus public, the private sort of setup, for example, like in myself, I run a business. So it's a very sole practitioner type of thing. So when you are involved in medical negligence or medical errors, you normally are directly relating it to a single person or a single business practice model. Whereas in a public type of setup, you're more related to an organization. So, say for example, in the United Kingdom, it'll be the NHS. In South Africa, it'll be the Department of Health. So you sort of a patient or a person that's got a complaint or a medical negligence claim, be it a lawyer, would be sending it directly to an organization in a public healthcare system, whereas in a private healthcare system, it would be directly more related at a specific practitioner. So both have got their pros and cons, both have got their own problems, their own sort of different type of challenges. But, in the end of the day, it always boils down to a single thing. You've got a patient or a person or a family member, a complainant that is making a claim against a healthcare professional for a specific type of medical error or medical negligence. So we need to clarify as we're talking on what's a medical error versus a medical negligence claim. So the medical error would be a adverse event that's occurred by a mistake that's done, that's occurred within a healthcare setup, that's landed up causing an adverse reaction or harm or something that's not within the sort of effect that you'd expect, or result that you'd expect with the patient, be it a misdiagnosis, be it a delay in diagnosis, or so forth. A medical negligence claim would be something on a different level, where the practitioner or the person involved or the organization involved has deviated from the norms of what we call a reasonable doctor, reasonable type of treatment. So to clarify those two terms before we move on is very important. A medical error is a mistake, whereas a medical negligence claim is a claim made against a doctor or a healthcare professional or organization that's deviated, what they feel is deviated from the norms of what a reasonable doctor or healthcare practitioner would have been made. So, if we can get past those two terms and those two events, it would make it a lot easier. With regards to the challenges that healthcare professionals are facing currently at the moment, it's a global problem. This is something that's affecting healthcare across the board. The COVID pandemic has exaggerated that, or has basically highlighted and sort of catalyzed the problems that we have as healthcare professionals, firstly based on the fact that healthcare is becoming more expensive, is becoming a lot more difficult to work with. There's the challenges of staffing, the challenges of burnout, the challenges of healthcare and providing a service in an aging, a more demanding patient regime, as well as the science that's improving. So as the science is improving, expectations are improving, are set at higher standards. And the problem with putting those expectations onto patients and family members and loved ones that have high expectations is that often if something goes wrong, they feel that they have to look for the scapegoat. And the scapegoat phenomenon is something that's occurring at the moment that I think is key and something that we need to really understand. Often when things go wrong in medical negligence or medical errors, it's not one single person or one single factor that's involved. And the problem is that's where the law comes in. The challenges with law, and it's not a negative thing, it's something that law falls short of science and something that science falls short of law. Law is very black and white. Law is very ethic bound, very opinionated, very case management type of thing. So they work according to opinions and to cases and experiences that they find in specific case law. Whereas science is a different type of thing. Medicine is a completely different type of thing. We look at studies, research, 10,000 cases, 10,000 opinions. We look at mistakes on whether this works, whether that doesn't work. That's how we're very research-based. So when you try to put the two together, that's where the challenge comes in. It's not as black and white as a lawyer or a judge would want to make a medical negligence claim. And it comes down to a principle that I use when I sit and look at cases, be it on a professional or be it on an amateur level, as what I'm doing currently, it's the captain of the ship principle. So if you've got a captain of a ship and a ship sinks, for example, if a patient passes away or if a patient has an adverse reaction, the doctor is often the captain of the ship, or the healthcare professional is the captain of the ship. So yes, the captain of the ship is responsible for that patient, but is the captain of the ship solely responsible for that ship sinking? And this is where the medical negligence claims comes in. And this is where the complexity of medical negligence claims come in. Because although the captain of the ship might be responsible for the ship, the captain himself wasn't directly responsible for it. So if the captain of the ship was directly responsible and he drove it into an iceberg himself and decided to sink the ship solely by himself, that's where the criminal intent and that's where the criminal accountability comes in. Now, the problem with medical negligence claims, or the challenges we find, is trying to debunk all those type of complexities to find out if the captain really was intently responsible for that patient or that direct risk that occurred or adverse reaction that occurred. And if you look at all these cases that we discuss, and I'm going to discuss, I always use two examples because I've looked at them very carefully, is one of Dr. Garber in the UK, who was a pediatrician, a registrar on call who landed up losing a patient and was criminally charged. And the one is the recent one with Nurse Rhoda from America that also was criminally charged for giving him a patient the wrong medication. In both cases, they looked for a scapegoat. And those scapegoats were those two healthcare professionals. And on review and on looking at these cases carefully, they realized that it was actually the system involved. So it was the ship itself, not specifically the captain. So this is where the challenges come in, where a healthcare professional wants to tell the truth. A healthcare professional wants to come out and say, look, I did make a mistake. And then the law comes in to look at it. And when the law comes in to look at it, they land up looking at a situation where it's very difficult for us to debunk it because the law is very opinionated and very case-based, whereas we need science to actually come out and say, listen, this is the problem. It was related to this, it was related to multiple factors involved. So it's that miscommunication or that inability for science to follow the law and for the law to follow the science. And it's something that we still haven't found the answer for. It's a global issue. It's a big global problem at the moment. I had a very long, very detailed, and very interesting debate with the head of the journalism authorities here in South Africa, and in that webinar that we did, it was abundantly clear that there is a massive miscommunication and there's a weaponization of the media based on whether it's social media, based on whether it's actual mainstream media, where doctors' hands or healthcare professionals' hands are often tied behind their back. So should a report come out, it's very difficult for us, and it's actually sometimes illegal and unethical for us to give our side of the story up until the point that it's properly investigated. And often what happens is the story that comes out of the patient, that of the loved one, poor understanding or inability to really come down to express their grievances without emotion and without the grief that's obviously affecting them at that moment. And I find the media link onto that grief and that type of anger and loss, and try to amplify that in a dramatic kind of way to try and obviously get clicks, links, or likes, because I mean that's basically what media is boiled down to, given the advent of social media. And you know, it was very interesting where the social media lawyer actually was giving a sort of comment to the journalists and mentioned that. It was a very interesting thing. She mentioned that, you know, if you are going to give a story tilted towards one side, you have to have your dots and crosses ticked and signed off. And I thought to myself, is that's an opinion. That's not really a story. A story should be factually based. given both sides of the story equally. And if you can't get the doctor's side of the story or the medical side of the story because we linked by confidentiality as well as it's sub judice where they've started a legal claim, and we can't necessarily discuss patients' files outwards or details in the mainstream media without patients' consent, or loved ones' consent or medical legal consent, then will it really be fair? And it should ideally be fair, because if you don't have the qualifications or the ability to really interpret the science before you print the story, then why are you printing the story? Are you printing it for dramatic effect? Are you printing it in the public's interest? Or are you printing it in the interest of really creating this negative type of exposure or culture or sort of environment for the healthcare worker to walk into? Because the layman on the street would read the story and turn around and say, listen, or this guy did this to a patient, or this doctor did this to a patient, and this is the adverse outcome, but not really know the details in between it. And when eventually we do find out the details, because it's a complex thing, it takes a long time, you find that the media don't report it with the same veracity or the same type of exposure as they did the original case. Because I find that's what journalism is coming down to these days. And it's very sad, because it's a science, it's an art, and it should be neutral and it should be factual and accurate. Otherwise, you're printing opinion pieces, and in the end of the day, you are inherently it's to the detriment of one party versus weaponizing it for the other party. And lawyers themselves have linked onto this, especially down here and in a few of the other countries that I've read the reports. It's often the complainant or complainant's legal team would use the media as a weapon to try and force the medical practitioners or the medical sort of the opponent's side of it to try and give up early, to try and avoid reputational damage or word damage, because that's what healthcare professionals work on, and that's what we sort of thrive on, is the fact that we are only as good as our last case that we performed, or we are only as good as the last patient we saw. So in the end of the day, if you've got a negative type of article that's been printed about you, or a negative type of report that's come out about you, with the fact that media is so open and Google is out there, your reputation is already getting damaged. And the longer you try to fight it, the longer you try to fight this media sort of storm that attacks you while you're trying to give your legal team the relevant science and the relevant medicine behind it, you're often caught between your lawyer telling you, listen, if we should rather give up and just give in and help out and pay sort of settlements, because the longer we drag this on, the more your reputation's going to be dragged on, and you'll end up giving up in the end of the day, which is not fair to the healthcare professional, and it's also not fair to the public, because in the end of the day they don't understand the story, or they don't really want to sort of understand that yes, there's two parties involved here, and you've only really heard the one side of the story, and you've got to wait to hear the other side of the story. So the media do need to come to the party, and I must say, it's not all journalists, because I do follow quite a few medical legal journalists, and some of the reporting, especially in the US cases, were very well reported, giving out very good sides of the story. And this comes down to journalistic experience as much as it does to sort of the intelligence and the ability to understand the science. So I think medical legal reporting in the media needs to a speciality that's taught to journalists when they are reporting these type of things as well. It is something that is the biggest, it's the one thing that we can sort out very quickly and in the short term. The Doctors Professional Councils, for example, in South Africa, we have a Healthcare Professionals Council. In the UK, we've got the GMC, and they need to be better funded. The Doctors Professional Councils or the Healthcare Professionals Councils are the key to this, because if there's a complaint prior to them starting legal processes, if we can get a properly funded, properly handled and a properly managed opinion from a peer, so a peer review process where you can actually get if there's a complaint against a healthcare professional, I'm going to say doctor because I'm tired of saying healthcare professionals, but I mean everybody. If there's a healthcare professional or if there's a doctor that's had a complaint against him, and if a patient is allowed to go through the process of going through our professional bodies, and if our professional body can efficiently answer the question, review the science via a standard peer review process of your colleagues looking at your work and your actions, and give that patient a formal report that's written in their terms and communicated to them well. And by opening up those lines of communication, we can cut down medical negligence claims and the whole process of this whole issue, I would honestly say by 90%. So if each healthcare body within the country was adequately funded, adequately and efficiently equipped, as well as completely neutral without being affected or influenced by third parties, be it politicians, be it council members, be it other doctors, be it lawyers or anything else. If it was just the science, if we could sit down with 6 doctors, 6 healthcare professionals, sitting down and looking at another healthcare professional's work efficiently and accurately and neutrally, and give that patient the answers or give that loved one the answers that they need quickly and efficiently, so that they can look at it and really get a good idea of what happened, what happened, what happened, what was the adverse event, and this is what we feel occurred. That patient can then decide, yes, I'm happy with this outcome, I'm happy the doctor's given me the thing, I want to take it up further, and a lawyer can look at this report and understand that this is the situation, this is what other doctors have figured out, and this is the way forward. I think it would cut down medical negligence by 90% and really solve our problems. It's the one thing that we can sort out in the short term. Adequately fund, equip, and allow our healthcare professional boards within our each specific countries to have the power and ability to answer these questions effectively, without the need of getting the lawyers or the law involved early. The law and the lawyers can get involved after the science has reviewed the claim. I think that we really need to understand that we always seem to be on the back foot. And this is the key of defensive medicine, is that medicine, with the current expectations, with the current aging population that we have, with the current sort of lack of funding, economic situations that we have, medicine has to be streamlined into being effective and efficient. And if we continue practicing defensive medicine, we literally on the back foot. We seem to be always defending ourselves against medical legal claims, violence, abuse, physical, mental burnout, and things. I mean, just today, if you read the news, a spine surgeon was shot dead in his office in Canada because a patient just wasn't happy with the outcomes 2 or 3 weeks after his surgery. It's the culture of finding the scapegoat, and we need to, as doctors and as healthcare professionals, be prepared for it and understand that these are the stresses of our profession, and we need to really focus and concentrate on how can we effectively provide a clinical service to save a patient's life without having our hands tied behind our back, thinking that we have to practice defensive medicine, because we could save a lot more patients' lives. And we could spend a lot less money if we had the ability to properly practice our clinical acumen without the need to worry about, will we be shot if we walk out into the street? Could we be murdered by or assaulted by unhappy family members or loved ones? And we need to get rid of that culture of trying to blame a specific scapegoat if there is an adverse reaction. And patients, lawyers, families, other colleagues and things, we have to understand that we are dealing with a challenging situation at the moment. And if we continue down this line, healthcare is just going to become more expensive. It's going to be more difficult. You're going to find that doctors are not going to want to be performing complex procedures. You're going to be finding a lot more patients out there that are unhappy with the outcome, and you're going to be getting a lot more lawyers with a lot more complaints. It's a vicious cycle that's going to carry on. And I always say this, I say, if you are sitting in a situation where you have a life-threatening illness or disease or injury, you want your doctor thinking as clear and as efficient and as unhindered as possible. You want that guy, or you want that person or that doctor to use his maximum amount of skill, ability, and function to save your family member or your family member's life. That is not happening at the moment. I can assure you that in this world, there are doctors out there that are not performing procedures and are not doing complex procedures that they know they can do based on the fact that they want to practice defensive medicine and they are afraid of the consequences should something go wrong. And it's all well when patients sit in your office or doctors or doctors are consulting. Patients will all be okay when everything goes fine. It's when something goes wrong, and that's in a rare situation, that everybody starts looking for the scapegoat. In the end of the day, we have to understand that medicine is as fallible as the patients we treat, and human beings are as fallible as the law is in itself. You know, just because I'm a doctor, I'm a surgeon, and I've got 20, 30 years of experience doesn't mean I can't make a mistake. The same way a human body, if I open it up, has got 32 million different variations that a textbook doesn't have. Medicine is not a exact science as much as the human body is not immortal, which is what we are trying to do at the moment. We are trying to use science to prolong life. And in the end of the day, things can go wrong and things will go wrong. And we need to understand that with the expectations of modern medicine, there should be expectations of modern law, and modern and patient outcomes need to be a lot more settled to allow us to perform our profession. You know, I think it's down to the fact that this is what it's patients' expectations, and the fact that we have social media, and the fact that everybody can have their voice heard. The bell has always been ringing, so there's always been issues with medical negligence and skyrocketing protection fees and insurance fees. The problem now is that the bell's just ringing louder. So it's always rang, it's just ringing louder now. And the fact that everybody's got social media profiles, reputations are always on hand, Google is available, doctors are a lot more afraid to sort of damage their reputations and things like that, because you can just Google a doctor and you'll pick up all the articles and everything about them. And the fact that the lawyers themselves have realized that this is also a very, very lucrative type of avenue to go through. Before, it used to be a very complex type of thing, a very specialist type of thing where lawyers and judges and doctors and things and expert witnesses had to follow specific processes. But with the advent of journalism, social media, and the weaponization of patients' expectations and the ability to use the media to damage a doctor, it gives them an extra weapon to use, and we have no defense against that. And the fact that healthcare professionals have no defense against reputational damage is probably the reason why the bell's ringing louder. And I mean, you look at it in terms of celebrities, soccer players, sports stars, and things. You know, there's this cancel culture that's coming through, and it's coming through the same avenue with healthcare. If a patient's not happy, if a loved one's not happy, even if it's something that was completely out of control of the healthcare team or healthcare professional, and if patients are angry and there's grief, untreated, poor communication, they can use every avenue to affect you. And it's something that we've just got to be a bit more mature about. And the public need to understand that if you do this, it's only going to cause a negative, it's going to cause a negative impact on healthcare going forward. Defensive medicine is not the medicine I want to practice. It's not the medicine you want to practice. It's not what we went through medical school to do. We are here to save lives. We are here to make sure that we use everything in my power and your power to make sure that we can do the best for our patients. And in the end of the day, if I'm sitting and looking at a patient, and if I'm thinking in the back of my head, could I get sued for this? If something goes wrong, if I'm worried about this, you need me thinking 100% fully for you, rather than for myself when I'm taking you to theater. And I think this is why we need to really be very pragmatic and very open-minded about how we bring everybody together and explain and intellectualize how can we improve medical negligence so that we protect patients, we protect doctors, and provide a good service. And it all comes down to communication. It all comes down to the doctors and healthcare professionals need to talk up more and speak more to patients and respect the fact that patients these days are a lot more educated as well as a lot more informed and have a lot more options available to them. And we need to also put away our secret type of medical language that we learn, because I find that patients often and lawyers often feel that we are sitting in this on this high horse or this different horse. Yes, medical science is completely different. You being a doctor, me being a doctor, if we were sitting at a social function and we were the only two doctors there, we'd be able to talk to each other, and we probably would land up talking to each other for the whole party or the whole function, because we speak a language of medicine. And lawyers, judges, journalists, patients don't speak that language, which could be a negative thing, because in the end of the day, they feel that we might be hiding something. And we need to be as open as we possibly can. And the patients need to also understand that, yes, medicine is a science that they don't necessarily understand. It's the same thing with the lawyer. It's the same thing with the judge. When you have medical negligence claims, and when I sit in these courts, we need the lawyers and the judges to focus specifically on intent and accountability, rather than sitting for 5-6 months trying to explain science of medicine to them so they can make that decision. We need to do the science, put it on their table, and let them then assess the law behind it. So if I'm trying to sit and explain 30 years of spinal surgery experience to a judge that has no clue of spinal surgery, and I've got to sit 3 or 4 months to explain to a judge 30 years of spinal experience and why this doctor necessarily did this operation, and this was the complication, and this was what happened. I want that judge to spend 6 months listening to the science, understanding that I believe that this is the science A, B, and C, and I want you to look at A, B, and C and then judge whether this patient, whether this healthcare professional's intent was there and accountability is relevant. Rather. So this is why I'm saying is that it all comes down to, when it comes to medical negligence, we all need to take a step back, understand that we are experts in our specific field, trust that we're experts in our specific field, allow the experts in those specific fields to give the information to the other experts so that they can do their thing. So this is where proper peer review, if you've got an adverse outcome that's occurred, there have to be experts within that field to review the science. It's like an aeroplane crash. It's the same way they do engineering crashes, engineering mistakes. It's not looking for a scapegoat as much as looking at the science to see what went wrong. So not only can we judge the intent and the accountability, but the key is we learn from those mistakes. So we can learn as healthcare professionals, as doctors and as nurses, listen, this is what happened. This patient landed up having an adverse outcome. How do we learn and how do we fix that situation? I always like to learn in threes. So if there's 3 things I could tell other doctors and colleagues, would be number 1 is communication. I mean, you've got to communicate. You've got to communicate with the patient, other doctors, lawyer, whatever need be. And, we speak about this all the time. You've got to open up the lines of communication. If there's something that's gone wrong, communicate it to whoever needs be. Number 2, don't do things that you are not qualified to do. And with medicine, with technology, there's always help available. Call for help. If you find yourself in a difficult situation, whether it be in an adverse outcome, adverse case, difficult patient, call for help. The more people involved, the more healthcare professionals involved, the more teams you have. Do not at any stage think that you're a god, because you're not. No matter how many times any doctor might think that they're on the pinnacle of their thing, I always find that the minute you start thinking you're above, you're the best, or you're this or you're that, you can never be. Medicine's got a funny way of bringing you back down to life. It'll be the next case or the most complex or simple case that you've done, and it'll just go all wrong and it'll bring you down. So number 1, communicate. Number 2, always know what you can do and know what you can't do, and call for help. And number three is just be safe. Take your time. Understand that in this situation, in the current climate that we're in, especially with COVID, is we've always got to remember, when it comes down to a resus, we talk about ABC, airway, breathing, circulation, and this is an emergency. But we tend to forget the three H's before that: hazards, help, hello. And the hazards got to be your own. You've got to understand that in the end of the day, it's not just hazards that are to the patient, it's to you. If you're taking on a case and you find that there's something wrong, that's a hazard to you. You've got to also listen to yourself and understand that you're not the superhuman robot that's running around that's able to save everybody. And in the end of the day, that whether it be medical to you, whether it be physical, verbal, to the patient, environment, whatever it is, listen to yourself, give yourself enough time, and always ask for help, and always understand that things can go wrong. And if they go wrong, you have to be honest about it. Don't change your notes. Don't do anything. Open up, be honest, tell the truth, and understand, and let the science be your shield, and let the science be your defense.